Vitamin D pairs perfectly with vitamin K2. One of the many things that vitamin D does is mobilize calcium in our body. It gets calcium into our circulation so it flows through the bloodstream. This is generally a good thing, but it does have a potential downside. Calcium can actually become very dangerous if it's deposited in our vasculature, in our blood vessels. Calcium deposition in our blood vessels is often called a high calcium score. And this is a major risk factor for cardiovascular disease, for heart attacks, for strokes, those kinds of things. But this is where vitamin K2 comes into the mix. Vitamin K2 activates a bunch of proteins in the body that are responsible for moving calcium to the places that it needs to be. So it will activate proteins that prevent the deposition of calcium into our blood vessels, into our vasculature, and it will also activate proteins that will ensure that that calcium gets into the bones where we definitely need it. K2 is different than K1, which is found in the green leafy vegetables, and while some K1 can be fermented into K2 in our GI tract by the bacteria in there, unless you're actually eating fermented foods that are high in K2, you're probably not getting enough. And you're almost definitely not getting enough if you're supplementing with vitamin D because you have that increased calcium in the bloodstream, so you need to make sure it gets to the right place. Additionally, there are various subtypes of vitamin K2, but MK7 seems to be the most bioavailable and have the longest half-life. It gets into the body and stays in the body better than all the other forms. I typically shoot for 180 micrograms of MK7 every day, and this can come from your diet, but if it doesn't, it's important to get it from a supplement. But make sure to keep this in mind if you're supplementing with vitamin D, which you probably should be doing in the middle of winter, because vitamin D is going to increase that calcium in the bloodstream, and you have to make sure that you have the vitamin K2 to ensure that that calcium is not going to the places where it shouldn't be and it's getting to the places where it should.